Good afternoon, everyone. Okay, we're just going to need a little bit more than that. Good afternoon, everyone. Thank you. I just first and foremost want to say welcome to the White House. We are just so thrilled that each and every one of you have made the trip, in many cases from places across the country, to come here today to join our Making Healthcare Better series, specifically focused on suicide prevention during this very important Suicide Prevention Month. So thank you. Thank you for making the trip, and we are so pleased to have you. And I just want to give everyone in this room a round of applause for being here today. My name is Bess Evans, and I manage all of our outreach and engagement on health and healthcare here at the White House. And we launched our Making Healthcare Better series event at the beginning of this year as an opportunity to really highlight the incredible work that this administration has done over the past 7+ years in specific spaces, but also to make sure that we are highlighting the incredible work that is happening in communities across the country. And that is being done by each and every one of you in this room and on our live stream today. I want to make sure that because we are live streaming, everybody takes out their phones and puts them on silent, as much as we would like to hear your Taylor Swift ringtone, so that folks on the live stream can hear loud and clear today. We do hope that we will have time for questions from the audience for both of our panels. And when you are asking a question, if you could please use the microphone, remembering that we do have folks that are watching from home. Legally, I need to tell you that emergency exits are at the back of the room and at the front of the room here. And then, not legally, but I must tell you, we have an incredible program here today. And we are going to be started out with the private sector co-chair of the National Action Alliance for Suicide Prevention and the retired senior vice president at Union Pacific Corporation, Mr. Bob Turner, who's going to start us off with some remarks and our introduction of another speaker as well. So we'll bring Bob up now.
Thank you very much, Bess. And let me add my thanks to all of you for coming out to this important gathering. The time for this country to get really focused on suicide prevention is now. I think all of us can look back at certain things and say, gee, that was a turning point, maybe a moment in history when something really changed. And I think as someone who has spent the last few years involved with the National Action Alliance, it really feels like in a few years we'll look back and say we're really at one of those inflection points because the data is getting better, evidence-based treatment is starting to come into the fore, all of the stakeholders, private, public, are engaged and are focused on getting at an issue that really needs attention. And I think this administration has done a fabulous job in pushing everyone to success. And while there's a long way to go, obviously, we really value, from the private sector and from the Action Alliance, really value the work that the administration has done in the Presidential Proclamation that was just out, and all of the other work as evidenced by your attendance today. The Action Alliance really sits in an interesting spot, kind of at the intersection of a number of efforts that go on both within the government and in the private sector. And I think that over the next few years, we have a wonderful opportunity to be the convener, to coalesce, to push where it needs to be pushed, to suggest where suggestions can be made, and make it so things are moving along in a great direction. Today we're going to hear from several people in the public sector who are influencing change in delivery systems that are starting to work, and we're going to hear from private sector partners who are leading this effort within individual health systems. In the second panel, we'll hear from another distinguished group of partners who share with us their lived experience as they interact with health systems or they or a family member struggle with suicidal behavior. The Action Alliance, through its Suicide Attempt Survivor Task Force and the Survivors of Suicide Loss Task Force and other efforts, is committed to ensuring that these leaders are convening to discuss national suicide prevention efforts. We have individuals at the table with lived experience who can share that experience to help inform future policy and practices. Our efforts to improve suicide care are strengthening when we listen to those who have experienced it and lived as a patient or a family member. We can learn from what went wrong and we can learn what we can do better from what they've experienced in their darkest hours. Everyone has a role to play in prevention. My path to this Action Alliance was accidental, but it has been I'm so proud to be part of it for what I've learned and for the opportunity to be part of something that is a crucial problem for this country, and to get the chance to know many of you who are so dedicated and so impressive in the work you do. When I was asked to introduce our next speaker, I was struck by either the humor or the irony, you can decide which, maybe it's both, of having someone whom you basically know nothing about introduce someone whom you know lots about. And thinking that, gee, maybe when Dr. Bonicelli comes up here, it'll be like having an old friend in the room, because he has worked so tirelessly over his professional career on very important issues for mental health and helping us with the Action Alliance. Excuse me. In fact, he was on the original executive committee when the Action Alliance was started by then Secretary Gates and then Secretary Sebelius back in the early days of the Obama administration. As I said, he was an early member and only stepped off when he took on this current position, where he is the director of the National Drug Control Agency and sets policy for this administration, which are based on balanced public health and public safety approaches. He's a career public servant. I spent some time in Massachusetts. I'm a fourth-generation son of the Bay State, and when we were talking earlier, I thought maybe I'd found a kindred soul, but he's from New York, so you'll have to forgive him for that, because he doesn't have that Bay State quality that I was hoping to point out to you as we go ahead. So it's my pleasure to introduce Director Bonicelli, the director, I want to get this right. My goodness, they didn't tell me what you do. Oh, the National Drug Control Policy. Thank you very much.
Bob, for that introduction. And while I was born in upstate New York, and I'm certainly very proud of that, I spent most of my adult life in Massachusetts. So I do feel like a kind of semi-native Bay Stater. So I want to thank you for all of your efforts. And it really is an honor for me to be here today, not only in my current capacity, but it feels somewhat full circle in terms of the work that I've been doing for a while, both on substance use and public health in generally. And I really had, as you mentioned, I had the honor during my time in Massachusetts to be a part of the Action Alliance to really look at our nation's strategy as it relates to suicide prevention. And, part of my job at the time, I hope I did an okay job, Jerry Reed is here, who helped facilitate that, was to really, I think, cement our understanding and nexus between substance use issues and suicide. And we know that it's multidimensional, and it has many of the same roots, and it has many of the same solutions. So it's really a privilege for me to be here today in terms of understanding that and how we can continue to promote the really good work that's happening at the local level, at the state level, and make sure that by the time we leave, we have really cemented our work around these issues. So we've known for a long time about the role that substance use plays in suicide for a while, because they share some of the same risk factors, including isolation, lack of healthy relationships, lack of supportive and healthy school environments and communities, family history, among others. And it really highlights and I think demonstrates some important areas that we need to continue to address, including community-based prevention services, screening, and appropriate and timely access to treatment. So we need the healthcare community to make sure that they're screening for both suicide and substance use risks as they're dealing with patients. We clearly need to make sure that we expand access to treatment to anyone who needs it. Just a couple of weeks ago, we released new national survey data on drug use and health. And I think while we're making some progress in many, many areas, one of the areas where we are not making progress and we need to do a better job is creating access to treatment for people with both mental health and substance use disorders. So according to the national survey data, only 39% of people who have either a mental health or substance use disorder are getting care for their treatment. And when you look at access to substance use treatment services, only 11% of people are getting access to care and and treatment. So this is a particularly important issue for us in this administration. And we've made some progress, and I think all of you know the Affordable Care Act actually made mental health and substance use disorder benefits part of the essential benefit package. And it also, I think, did a remarkable job in building on the work of my good friend and colleague, Congressman Patrick Kennedy, on making sure that those benefits are offered on par with other medical surgical benefits. But despite the fact that we've had that law, and he was a huge author and champion of that, it's an unfulfilled promise. And Patrick and I have talked on many occasions about this, and the president heard him. The president has created a task force to do a number of listening sessions and comments. We had over 1,100 comments and listening sessions to make sure that the federal government is doing everything that we can to make sure that insurance companies are meeting their obligation in providing good, essential mental health and substance use disorder benefits like they do any other disease. And we have a ways to go, and we have him to thank. He's been a huge champion on these. But we can't do it alone. Congress needs to act on our request. So the president has proposed $1.1 billion in new funding to make sure that every American who is seeking treatment gets it. And I will have to say, on a departure note, so Congress just passed a continuing resolution yesterday. I think many of you know they passed what's called the Comprehensive Addiction and Recovery Act. And while it had language that authorized grants, it had actually no additional appropriation attached to those grants. And in a continuing resolution, only funded $7 million of what grants were estimated at $181 million. So Congress didn't even fulfill its own promise by funding a bill and grants that they passed, let alone really doing a good job at passing the president's budget as it related to accessing to treatment. And we know what that leads to. So Congress has a role to play here. We know that risk for suicide is higher among some groups in terms of both LGBT populations, members of our armed forces and veterans, American Indians and Alaskan Natives, survivors, those in justice and child welfare systems, and others. And we need to be mindful of those specific strategies to help these populations. Just last week, we had an event here at the White House around LGBT issues where we discussed new data that shows that drug use among LGBT, both youth and adults, is higher across the board. Marijuana, cocaine, ecstasy, heroin, misuse of prescription pain medication, and methamphetamines. And our veterans are also acutely affected by both substance use and suicide. From 2001 to 2014, suicide death rates among our veterans with opioid use disorders who use Veterans Health Administration services. So we know we have work to do, and I'm really glad to be joined today by Dr. Carolyn Clancy, who has been a huge issue, not just on suicide, but also on spearheading and working on our issues around opioid use in our veterans, and you're really to be commended in terms of the work that you're doing. I think last year, you know, the president signed the Clay Hunt Suicide Prevention for American Veterans Act in honor of a veteran we lost to suicide. This law will help improve how we serve veterans with post-traumatic stress and other illnesses. The connection between suicide and substance use is underscored, quite honestly, by the opioid epidemic that we're facing in the United States. Drug overdose is one of the primary methods of suicide. In 2014, it accounted for 13% of all suicides, and opioids were involved in a third of these. While this is not, what I'm going to say now is anecdotal, but I believe, quite honestly, that we are dramatically underestimating the role of opioid overdoses as it relates to suicide in the United States. And I think this is an area of further research and focus that we need to underscore. We know that people with addiction have a sense of hopelessness. And I can't believe that these numbers are undercounted as we think about the intersection between intentionality and overdoses. And so a significant part of our work to reduce substance use disorders is breaking the stigma around them. And this applies to suicide and mental health issues. And if we're going to really make progress, we need to continue to talk about these issues openly and candidly, because that's the only way that we're going to break the silence and build momentum to make needed change in our country. Those of us who have been personally impacted by these issues, I believe, have a unique obligation to speak openly and candidly about our own experience. And again, I really want to thank Patrick Kennedy for using his incredibly large bully pulpit to talk about his own experience. I think the more that we as leaders talk about these issues, the more that we empower everybody else to talk openly and candidly and to do the same. So you have a terrific lineup of speakers and panelists today, and I want to thank Bess Evans, who has been remarkable not only in pulling these series together, but doing a tremendous amount of work in making sure that we're making progress on our opioid initiatives. So thank you, Bess, for pulling everybody together. So we have people from government, from the advocacy and nonprofit world, from community resource organizations who will share their perspectives on how we can move forward in preventing suicide. So it's great that you're all here today. And before I turn it over to the panel, I want to share something that President Obama wrote earlier this month in a statement designating Suicide Prevention Day. He wrote that this day is a time to join with neighbors across the globe to reaffirm our commitment to preventing suicide. No one should feel alone when facing these challenges. There is always hope and always a helping hand. So I'm sure you're all going to have an engaging discussion about how we can make sure people can find and always find the hope and helping hand that they need. So thank you, everybody, for the remarkable work that you're doing, for your partnership with us at the federal level, and keep up the great work. Thank you.
Now, I know we are running just a little bit over time, but I can't say goodbye without having our two fabulous closing speakers close us out today. We are just so incredibly thrilled to have Dr. Christine Moutier, who is the Chief Medical Officer from the American Foundation for Suicide Prevention, as well as Dr. Carolyn Clancy, who is the Deputy Undersecretary for Health for Organizational Excellence at the U.S. Department of the VA. So I'll turn it over to Dr. Moutier.
Well, I just have such incredible respect for the wealth of knowledge, lived experience, and passion in the room. And talk about breaking down silos and making progress. I think the fact that this conversation has been happening in an ongoing way and at this national level is truly telling and gives me hope for the future. As the Chief Medical Officer of the American Foundation for Suicide Prevention, I really would love to thank President Obama, the First Lady, and Dr. Biden for their leadership and commitment to mental health and suicide prevention. And certainly a special shout out goes to Bess Evans for her tireless efforts in making healthcare, and particularly mental health care, more accessible to all Americans. So obviously we've been highlighting the fact that the rise in the US rate of suicide, 24% over the last 15 years, has reached a national crisis, and we are now speaking out about that in an ongoing way. We've just heard from a panel that the mortality toll of suicide is actually just the tip of the iceberg, that there is a whole range and spectrum of suffering that goes on, and that within all of your workplaces, your churches, your neighborhoods, people with lived experience who have been touched by their own personal experience or lost to suicide are all among us. The number of individuals, families, schools, and workplaces who are impacted by suicide attempts, there are greater than 1 million suicide attempts in our nation each year. That boils down to 125 suicide attempts per hour, day in and day out. The suffering in silence must stop. We live in 2016. It's time that we show compassion for the 1 in 4 Americans who live with a mental health condition. It's time that we make mental health care affordable and accessible, and it's time to ensure that leaders in every sector, from corporate to government, but especially leaders in healthcare, understand the legitimacy and the pivotal nature of mental health. I want to share just a couple of examples of what I'm seeing as indicators of the changing landscape around mental health that actually give me a lot of hope. Recently, national leaders in academic medicine and medical education have come together to address the problem of physician wellness and physician suicide. A study just this week published by Dr. Gold found that 50% of women physicians report that they likely met criteria for a mental health condition as they looked back on their career, but had not sought treatment, mainly out of fear associated with stigma that still lingers in our culture about mental health and help seeking. when we as healthcare leaders and experts cannot even allow ourselves to be human, to be smart and seek the treatment that we need because it's not safe for us, or at least it doesn't feel safe, it's no wonder that our nation has seen conditions like depression going unaddressed and rising to become a leading cause of disability. It's time to act based on reason and based on science. And thankfully, leaders within the healthcare profession, including medicine, are taking that call to action seriously. So despite the hard work that is yet to be done, there is good news. Another indicator, a recent Harris poll that we and others put together, found that the American perceptions around mental health are changing, that greater than 90% of respondents view mental health as equally important and valid as their physical health. And actually over 90% said that if someone in their life were struggling with suicidal thoughts, they would want to help. Another indicator, you've heard about the Out of the Darkness suicide prevention community walks. Among run-walk events of that nature for awareness raising, the Out of the Darkness suicide prevention walks are the second fastest growing event in the nation. This tells you what the American public is interested in and is clamoring for attention to. And researchers continue to find the answers to what drives suicide and what works to prevent suicide, even interventions long before the suicidal crisis has emerged. So at the American Foundation for Suicide Prevention, we have set a bold goal to bend the rising tide in our national rate of suicide and to reduce the suicide rate to 20% by 2025. To accomplish this, and adding to all of the efforts that you've been hearing about that are phenomenally important, the American Foundation for Suicide Prevention launched Project 2025. Project 2025 is analyzing who we are losing, where we are losing them, and how we are losing them. Using a dynamic systems model, we've identified actions that will reduce the rate of suicide in the shortest amount of time and with the potential to save the most lives. So one example for Project 2025, we know, we've already heard about this quite a bit today, that a high percentage of those who die by suicide have been seen by a medical professional, either in primary care, behavioral health, or emergency departments within days to weeks of their death. These are people who've come in contact with the healthcare system, and their risk for suicide was either missed or they just didn't get the help that they so desperately needed. And just as we've heard so much about the amazing zero suicide framework, through higher standards of care, better training of healthcare professionals, and greater use of effective interventions in these settings, we can save many more lives. Another example from the project, 50% of those who die by suicide use a firearm to take their life. So Project 2025 is working with the gun-owning community, firearm retailers, instructors, shooting ranges, and local communities to promote suicide prevention education. And this is just the beginning. We know that we can't do this alone. You'll be hearing more about Project 2025 in the months and years ahead, and how an all-out effort from leaders across industry sectors and communities nationwide can work together to implement effective programs, policies, and interventions that will save the most lives in the shortest amount of time. Using evidence-based strategies, we can save lives and allow many more Americans who are struggling today to live full, healthier lives. So with that, I would like to next introduce our closing speaker, Dr. Carolyn Clancy. And she is a remarkable and accomplished physician in the field of quality and healthcare system leadership and strategy. She's trained as a general internist, and she, she has many accolades, including being a member of the National Academy of Medicine and the Institute of Medicine, but I would say probably equally important to the many accomplishments on her resume are what those who work with her and under her say about her. They tell me that she's an extraordinary leader and that she's a mentor to many. So I'd like to welcome Dr. Clancy, who is a fierce advocate for suicide prevention, especially in our veteran community.
Thank you so much. Well, good afternoon, everyone. If I had to sum up this afternoon in one word, it would be wow. I came here with pretty high expectations, and they've all been exceeded. This has been an incredibly important forum. So I want to thank you, Christine, for a lovely introduction, and thanks to the American Foundation for Suicide Prevention and the Action Alliance and the White House on organizing this critically important forum, and of course, the amazing Bess Evans. As public sector co-chair of the Action Alliance, I've been very proud to be part of this unique partnership with the private sector in advancing a national strategy for suicide prevention. This is incredibly important to veterans because, as you heard people say in a variety of different ways, 20 veterans a day take their life. 6 of them get their health care from us. The rest get health care elsewhere. Even those who get health care in our system often are getting health care elsewhere. And by the way, there's a whole lot of real life that takes place between health care encounters. So our goal is all of those veterans to be able to prevent those needless deaths. And we can't do that without partners. And just to be reminded today about the amazing partners who are out there and to be part of this alliance is just very, very inspiring and the source of a lot of hope for me. As a Deputy Undersecretary for Health, I'm honored to work with Dr. Shulkin and a number of really terrific clinicians, researchers, social workers, and other VA staff who work every day to help prevent suicide. And it's personal for me. I lost my mother, and we lost a very close friend who took his own life a few years ago when he was home on leave. So this is something that has affected so many of us. So I have to agree with you, Bess. Panel number 2 was the best. Just absolutely. It's an incredible gift to share that lived expertise. So thank you. I learned this a little over a year ago when I asked the parents of a veteran who had taken his own life, Gene and Howard Summers, who've been extraordinarily generous and energetic in their efforts to help us do a better job preventing suicide and, frankly, to make VA health care be all that it can be. I asked them to join me in a webinar, and it was a little bit more like a talk show on TV, although I was not quite up to the part of being that kind of hostess, but it was something that you could watch live or later on demand. And what blew me away about this was clinicians tuned in, and people who assist clinicians, but far more employees who are several steps removed from the direct provision of care, either emailed in their questions then or later because they had family members or because they'd heard we were trying to make efforts to see veterans that day with an urgent mental health problem if at all possible. And you heard Dr. Shulkin talk about that. And they weren't really sure, did that mean all veterans or was that only young veterans or people who'd served since 9/11 and so forth? And it made me more aware than ever why Henry Ford system has been so successful, because it is a team sport. Every single person who's part of that healthcare experience has to be part of it. You also heard Dr. Shulkin refer to this for veterans as a crisis, and it reminded me, and the discussion this afternoon reminded me about the old adage, right, that there's a symbol for crisis that means both danger and opportunity. And hearing from everyone today reminded me very acutely of the opportunities. I want to touch very briefly on some of the research that's going on in our system that gives me a great deal of hope, and then just end with 3 major points I'll take away from today. So many of you may not be aware the VA does a lot of research and has been for about 90 years. And focus on post-traumatic stress disorder, traumatic brain injury, spinal cord injury, and chronic illnesses that are unique to or more common in veterans is a very, very big part of that portfolio, which also includes a strong focus on substance abuse and suicide prevention. So we have a number of centers of excellence, and just by way of a few examples, a center of excellence for suicide prevention based in Canandaigua, New York, which was the home and hub of the first crisis line, works towards reducing veteran suicides primarily by studying and applying public health approaches. Okay, so this is outside of healthcare. Another center in Denver The researchers are focusing on how do we translate these promising research findings into improving everyday practice as rapidly as possible. And another center in Little Rock focuses on research to improve access to and engagement in evidence-based mental health and substance use care. We also work very closely with the Military Suicide Research Consortium. Very importantly, we have a very large cooperative study going on now that we were thrilled that President Obama mentioned at the American Legion Convention a couple of years ago, focusing on 1,800 veterans with bipolar disorder or depression who have survived a suicide attempt to see if lithium can actually help prevent suicide in those at increased risk. Obviously, listening to the second panel, lithium alone won't do it, but is that a very key part of the recovery and ultimate survival process? The last thing I want to mention to you is this year we have been focused very strongly on diffusing best practices. So we're asking the people with the most knowledge, that is to say the people who are providing care, to submit what they consider best practices, and we have a whole contest around this that involves a Shark Tank-like event. And so far we've received input from about 70 facilities out of about 150 and about 3,000 ongoing implementations. So related to suicide prevention, we've seen a partnership with local law enforcement in rural Indiana to help police officers better understand veterans with post-traumatic stress and suicidality and help them understand VA resources and so that they can help get the veterans into care. That has been hugely important. Another effort in Atlanta is providing greater clarity and definition for mental health nurses in outpatient care so that we can improve employee engagement and veteran outcomes. And in Miami, VA staff have just completed a pilot project for a triage tool that addresses the current gap in protocol interventions specific to acute mental health care issues. So this is just a small teaser of very exciting work in progress. I think my colleague, Dr. Ira Katz, was here earlier and may have left. We're also now going to be testing some approaches based on big data, identifying those at higher risk of suicide to see if that will actually help us intervene earlier. Doing this in a way that's sensitive, that doesn't put a big label on veterans and doesn't in any way increase stigma, which would be exactly where we don't want to be, is going to be a vital part of this. So as a clinician and a researcher and frankly a survivor, I'm greatly encouraged by the research, innovation, and best practices that we're seeing at VA. The progress we're making will help veterans and all Americans at risk for suicide. And Dr. Franklin, I was just inspired by that video. And I can say, as a family member and close friend of two people who took their lives, I know that there's a lot that we can all do, and being there is a very big part of it. Number of people this afternoon mentioned reducing stigma. I'm going to tell you, based on my own experience, I think I would qualify for an advanced degree in the many ways you cannot talk about the issue. And if you ask, by the way, you won't be planting the idea in someone's head. I can almost guarantee they've thought about it before and may be immensely relieved to actually have someone ask. But being there is just so important. So if there's three messages I will take away from this afternoon, one is the very important messages we heard from those with lived expertise and what a gift it is that you can share it. So thank you from the bottom of my heart. A second, and this is one we live with every day, this is a team sport in the broadest definition of the word. We need as many partners as possible, and having an opportunity to share what we're learning like this is really incredible. And the third, that I think we all know but probably don't say enough, but we heard this a number of times. There's a very close relationship between preventing suicide and the response to multiple kinds of crises. which might be the death of a spouse, might be loss of a job, could be discharge from service, and where is my life, and I don't know how to be anymore. It could be many, many things. And I think the more that we can bring those things together, we will make our partnerships even more powerful. So again, thank you all. I want to congratulate the organizers, and again, thank particularly panel number 2. That was really, really special. Thank you.
Thank you to Dr. Clancy, to Dr. Moutier, and to all of you. I know that our program ran a little longer because we just had too much to pack into the time that we had, and I think we could spend weeks in this room, although maybe not in this windowless, non-social media conducive room, but in some room talking about all of the work we have to do moving forward. And I just want to remind folks that this is the beginning of the conversation, or even the middle of the conversation. It's not the end. And for better or worse, you'll now get lots of emails from me. And I expect to get lots back, because we have 4 months left to run through the tape here for this administration, but a lifetime of work to do altogether. So thank you so much for coming today.